Talk with Dr. Michael Smith, MD. And now, here's the country doctor with a city education, Dr. Mike.
So what can stem cell therapy accomplish for lung disease? My listeners, you guys know I've talked about stem cells and what they are and stem cell therapy. So this is a very interesting topic. My guest is Dr. Jack Coleman. He is the medical director of the Lung Institute in Nashville, Tennessee, where he oversees the medical staff in the treatment of people with lung disease using stem cell therapy. Dr. Coleman, welcome to Healthy Talk. I was just kind of giving the listeners my take on stem cells and why it's such a promising form of therapy. But why don't I let you take that over, Dr. Coleman? Why don't you just give us a nice, simple layman's, definition of what a stem cell is and why they are so promising as a form of therapy?
Well, a stem cell is a cell that has not differentiated. In other words, it's a cell that can potentially turn into any type of cell the body needs. And as we get older, our stem cells will start to change. They'll start to differentiate more and more. You can almost think of it like a tree that's upside down, where the trunk of the tree are the embryonic stem cells that have the potential to be anything in the body at all. And then as time goes on, as the differentiation process takes its various steps, then you go down to different branches of the tree to the different tissue types and the subtypes of those tissues until you get to a specific cell type, such as a muscle cell or a nerve cell or a liver cell, whatever kind of cell the body needs. The reason that these are so important in medicine today is that we can actually start to use the body's cells, the body's own natural healing mechanisms, to treat diseases that previously we've been treating with drugs and other exogenous type of therapies. And so we think that we can get, number one, a much more natural type of treatment using the body's own tissue, the body's own cells. And because it's the body's own healing mechanism, we can probably direct the healing much more carefully, much more precisely than we can just showering the body with the drugs and other kind of chemicals.
So let's Dr. Coleman, walk us through the process just a little bit. We don't want to get too heavy with it or too deep, but walk us through how it actually works. Where did the stem cells come from? Are you using the patient's own adult stem cells? And just how does it actually work? What's the process for using stem cells in treatments?
Okay. Well, a couple things to know about stem cells. I think when the public hears the word stem cell, the first thing that comes to mind is that we're going to regenerate organs or we're going to regenerate the tissue back to its normal function again. And the stem cells can do much more than that. They have other properties that help the healing process besides just regeneration of tissue. They have anti-inflammatory properties. They have immune modulation properties. They have growth factor properties. They have what we call cytokines, which are chemicals that cells can produce that will attract other cells into an area that needs healing cells or new blood vessel growth, whatever. So the important thing about stem cells is that they have a lot of different functions besides just tissue regeneration that the body can use for healing. We have stem cells throughout our body. Every organ has stem cells. The question is, how active are those stem cells? And if they're not active, how do we activate them? And in what quantity are the stem cells there in a certain volume of tissue? So when we think about stem cell therapy, we think about where can we get cells that are very active, where can we get cells that are closer to what we call totipotential or have the ability to differentiate down many different types of cell lines, and how easy can we obtain these cells? If you get to a very active tissue like the bone marrow, where we're always replacing our blood cells, then that is a great source of cells for us to use. And that's the source for almost all the cell therapies that are out there right now is the bone marrow. And that's what we use as well. We use what we call autologous stem cells, meaning that we're using cells from the person's own body. The reason that we do that is that we don't have to worry about rejection reaction. There are also cells that can be derived from donor tissue or donor patients and given to a person. That's been done a long time, a number of years, treating things like lymphoma with bone marrow transplants. It's a great technology, but again, you have to deal with rejection reaction.
Right,
and by using the patient's own cells, we don't do that. We don't have to deal with that.
Well, let me. So, Dr. Coleman, so when it comes to lung disease, so what are some of the lung diseases that are currently, are currently being used for with stem cell therapies, and where do you see the future of this for lung diseases, say 5 years from now?
Well, I think we're really in our infancy in treating lung disease with cell therapy, and the diseases that they're having the most success treating right now are the ones that would come under the heading of COPD, or chronic obstructive pulmonary disease, and ILD, or interstitial lung disease, and those would include things like pulmonary fibrosis and bronchiectasis. And the reason I think that we get response to these diseases is that the common pathologic factor in all these is uncontrolled inflammatory reaction. And the stem cells have very strong anti-inflammatory properties, so that at this point in time, we can't actually cure these things, cure COPD or cure emphysema, but we can slow down or even arrest the process that is causing the problem. And heretofore, we have not been able to do that. All the medications that we use, the steroids and whatnot, are all designed to relieve the symptoms, but they don't do anything for the disease process itself. Now, in the
which
future,
Dr. Coleman that's one of the reasons this is so promising, right? I mean, I think conventional medicine, and I think you would agree over the years, has become really good at applying Band-Aids. But this stem cell really is entering into this era of really providing solutions to some of these degenerative diseases, including lung disease, right?
Absolutely. And I think we're kind of almost at a beginning of a perfect storm right now, because we've got the stem cells, we have the ability to harvest stem cells, to culture and reproduce them. But I think the other part of this is looking at things like bioengineering, nanotechnologies, other mechanical technologies that are going to allow us to not only utilize the stem cells, but also be able to create the structures and the platforms for us to start to regenerate more complex organs. We can do it pretty well right now with simpler organs that only have one or two tissue types, for instance, bladders, which are mainly muscle and epithelium, or regenerating heart muscle acutely after things like a heart attack. We're getting
I'll tell you what, Doctor, let's hold it there. Well, Dr. Coleman, unfortunately, I have to cut you off short. We're going to have to leave it there. If you want to go check out the Lung Institute, you're going to have to Google it. Dr. Coleman is in the Nashville, Tennessee area. So thanks for coming on, Dr. Coleman. This is Healthy Talk on Radio MD. I'm Dr. Mike. Stay well.